found it a stressful event? Almost everyone. Now, who has ever been able to convert this stressful situation into positive experience? Wow, 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 good for you. And that's what we're going to talk about tonight. So we're going to have this little introduction, about 5 minutes, and then we're going to have a real life role play, about 3 to 5 minutes, and then everyone critique the session. After all, who can agree with others 100% of the time? Argument can be healthy. Studies show people capable of expressing the difference have much less physical and mental stress, and much higher chance of solving the problem to both parties' satisfaction. So the number one attitude is to be non-defensive by following steps. First, listen. Lots of feelings were buried under the verbal language and could be the real reason people are upset. If we utilize good listening skill to find the underlying emotion cause, it will be much easier to find and solve the problem. Second, acknowledge. Acknowledging doesn't mean we agree with criticism. Just simply recognize our criticizer may have a point of the opinion or emotion. Many times people just need to be heard and recognized. They may not need us to comply 100% of their demand. Third, ask question and paraphrase. Asking questions will help us to understand the true issue, and paraphrasing will help our criticize to reflect their feelings and opinions. 4, agree with the truth. If our criticizer has a merit, why not say so? It will make it easier to solve the problem peacefully. And there's few more important points. First, use nonverbal listening skill. Smile, lean forward, and nod, murmuring acknowledgement, keep eye contact, and pay attention to our nonverbal messages, facial expression, gesture, and tone of our voice. Second, don't take it personally. Our criticizer may just have a bad day and may not be about us. 3, show respect. Say something like, it is clearly, I can see you're very upset. Can we try to talk about it? 4, stay calm no matter what happened, because that's the only way we can stay non-defensive. Now let's give a life example. A wife is very upset because her husband forgot their anniversary. She would say something like, you don't love me anymore. So this would be very nice if the husband started a conversation with acknowledgement. Honey, I can see that you are truly upset by this. Can we try to talk about it? The wife may say something like, yes, I feel hurt. You always forget things. So if the husband been utilizing a good listening skill, he will realize the forgotten anniversary is not the only reason the wife was upset. It would be a great point to use this ask question skill. Honey, I must be forgetting other things lately. What else did I forget? So wife most likely come with a list this long. And then that's the best time to use paraphrasing. Yes, I forgot Jimmy's football practice last week, and I forgot paying mortgage last month, etc. Paraphrasing show our criticizer that we're really listening. And then will be the time to agree with the truth. Yes, I can see that I've been forgetful recently, but we don't have to agree with the conclusion of the criticizer, but I still love you. And then time comes with a good solution. From now, honey, I'll put our family calendar on my iPhone calendar, so I will be able to remember them better. And realize the husband never come with any excuses, because the wife will find a hole in it before he even finished the first one, and the argument will start. Okay, so let's put all these theory into real life testing. And this is not rehearsed. Bill will play an unhappy patient, and I'll play the doctor. Okay, Bill? Okay. Mr. Atkin, how are you doing today?
You know, Wendy, I don't know, Dr. Wendy, not good. You know, I've come to you twice so far, and I thought all my problems are going to be resolved, and I have the same problems. 2 times I went to you, and they're not resolved. I want to know, you know, what's going on here?
I can tell you're very upset. Can we talk about this? What you're not happy about?
Well, I came here for results. I 2 times, and I spent money on it. I spent $300 the first session. I thought my problems would be resolved. You know, we have all these great ideas, but I'm still having the same problems. I'm still arguing with people. I'm still stressed out. I'm still on edge.
Okay. So I can tell you still feel very stressful, and you cannot control your emotion better than before. Is that right? Okay. So let's talk about this. Have you been doing our program lately that we try to eat gluten-free diet and a lot of vegetables?
Well, I tried it, but then, you know, when stress takes over, I go back to my regular ways, and it's, you know, I try these supplements, and you know, again, I want some immediate response, and I'm paying a lot of money, and it's not working. I don't know what's going on.
I can understand the frustration, but Mr. Atkin, try to imagine how you feel when you come to my practice, and it take years of the lifestyle cause the mood disability or the other symptom you have. So it would take a little bit longer for us to change your health. And the good way to think maybe is keep on trying to visualize how good you will feel if you stay with a program a bit longer, maybe 3 months, and we may be able to see more result. What do you think about that?
So in 3 months, I'm going to be better. I'm going to feel better. I'm not going to be stressed out at people. I'm not going to be on edge in 3 months.
Oh, as a doctor, we cannot guarantee the report. I think will be much higher chance than, because you only do this for like a month. So if you give 3 months time, I think there'll be much chance of getting the result. And also, maybe we can do other things like practice yoga, do a little exercise. I think that will also help your new developed lifestyle.
Yeah, it's just I'm still stressed. It's just I'm trying to get to that point. But two visits I had with you, I thought I'd be.
Yeah, but 2 visits only a month. I think it may take a long time.
Yeah, and another side issue, not to be stressed out on that too. I went to make an appointment with you, and I have to go to the internet and sign up on the internet. I have to find a computer, sign up. It's just a real hassle to me. So it's difficult for me to even to come to you because I have this computer thing I have to worry about every
That's
time.
true. I understand that's a little inconvenient for the patient. I agree. So for that, let me do something for you, okay? If you have problem, send me an email, tell me the time that you want to come. I'll make the appointment for you.
Okay, so I don't have to do that computer stuff anymore. I could just
Yeah.
message.
Just consider your habit not using computer. I think the least I can do.
Okay, and so you're saying in 3 months I should start seeing some effects of this. So
Yes,
okay,
I
right?
think you will feel much better in 3 months.
And you've had other people that you've been able to do this for? You know, so far we've talked about it, but I haven't seen those results. That's what I'm really anxious for.
Right.
I'm stressing out.
Yeah. Oh, yes. If you talk to some of my other patients, maybe you'll feel better. You know, maybe stay in the waiting room a little longer, whoever
There's a lot of
comes
stressed
in.
people there too.
All
That's why
right.
you got my stress in there too.
Okay. Or maybe, you know, I'll go internet to do a little research, see how other people talk about me. And of course, you know, it's all up to you. And do as long as possible, and keep on taking the supplements and do
And
the
the
lifestyle.
supplements, that's gonna have those effects that we have with getting things done quickly?
Yeah, the supplement I gave you, like for the adrenal, will help you to be able to deal with the stress. And then the calming herbs will make you less anxious. But you have to really do it 2 pills twice a day. Okay, if you skip the pill, and it may make you, you know, anxiety may come back. But after a long time, you know, once you're all set, then you don't need to take the pill all the time.
So I wouldn't have to take these forever, just that some like 3
No,
months,
no.
I'll be good.
It depends on different kind. Adrenal may take 6 months, but some of the herbal, once you feel not anxious, we can decrease it. It's not forever. It's just the therapy thing.
So
Yeah.
I have to continue 2 times a month until 3 months, you're saying?
Right now, I think you've been doing every 2 weeks. We can move you to maybe once a month, once you get a little better, every 2 months, and then maybe every 3 months.
Just I'm anxious, I want to get those, you know, I want those results.
I know. You know, why don't you come in for some acupuncture treatment? I think that would be great for anxiety. Do you feel like trying that?
Does it hurt?
Oh, no, really? No.
I'm a
Just
chicken,
tiny littles, and it calm your mind. I think that would be great for the anxiety treatment. It's Eastern medicine, you know, it totally use energy treatment. I think that would be a perfect fit for you.
Okay, so I don't have to do the online stuff anymore, I could just email it.
Email
This
me.
acupuncture stuff will get me where I want to be for the 3 months, right?
Yeah, let's give it a try. I bet you're going to like it. Yeah, and it's great for anxiety. I always think acupuncture with electricity stimulation on your scalp would be a perfect treatment for the anxiety. Well, give it a try. Only take 1 time, and you may love it. Yeah, I feel great about it. I think we should give you acupuncture
But
treatment.
it's not like lobotomy, right?
Yeah. Okay, so I think I'm very happy we talked today. I have a good feeling. I think you're going to get better with little time. And let's try some acupuncture. I think that will help you more in a big time.
Okay.
Okay, very nice seeing
Thank you,
you
Dr.
again,
Wendy.
Mr. Acton.
Okay.
Okay, thank you, Bill. Okay, oops. Okay, now, anyone have any suggestion, critics? Everyone is open to the general floor. This is my real life experience. Yes, John.
Bill said that he was having difficulty with the PC, making an appointment,
Right.
and you recommended an email. Is there a way to the PC?
Okay, change the phone.
Okay, thank you.